Alright, team. We have a difficult case on our hands. The patient is presenting with symptoms of sesamoiditis, 5-hydroxyacetotetraenoic acid, and tenosynovitis.
Based on these symptoms, I think it could be arthritis combined with an inflammatory condition.
I disagree. I believe it might be a rare autoimmune disorder causing joint inflammation.
I'm leaning towards a metabolic disorder affecting the joints and causing inflammation.
I'm not so sure about any of those. Maybe it's a combination of a genetic disorder and a nerve condition.
Enough. You're all way off. This is a case of hyperkalemic periodic paralysis.
But Dr. Hawks, how can you be so sure?
I just know. And we don't have time to waste. The treatment is clear. We must perform an anterior temporal lobectomy.
Are you sure, doctor? That procedure is extremely risky.
I am sure. We must do it now. It's the only way to save the patient's life.
But what if?
I don't want to hear any more doubts. Get ready for surgery. Now. Tracy, I need to talk to you about my patient. I believe he has hyperkalemic periodic paralysis, and I want to perform anterior temporal lobectomy on him.
Hawks, are you sure about this? You've been wrong before on such diagnoses.
Don't you dare question my years of experience, Tracy. I know what I'm doing.
I'm just concerned, Hawks. You have a track record of making mistakes.
That's in the past, Tracy. This time, I'm absolutely certain. Trust me on this.
I'm not sure I can take that risk. You need to be certain before proceeding with such a drastic measure.
Look, Tracy, I understand your concerns, but I know this patient better than anyone. Trust me, this is the right course of action.
Fine, Hawks. I'll give you the green light, but if anything goes wrong, it's on you.
Thank you, Tracy. You won't regret this decision. I'll make sure everything goes smoothly.
I already regret this. The patient is in critical condition, Gary. We need to act fast to save them.
I can't believe this happened. Anterior temporal lobectomy was not the right treatment for hyperkalemic paralysis, despite Dr. Hawks's insistence. We need to figure out the correct treatment as soon as possible. What do you think we should do?
I'm sure we can come up with a solution. Maybe we can try administering potassium, sparing diuretics to help manage the potassium levels in the patient's body.
I've got it. I have a spare banana on me. You get the jaws of life and I'll cram it down there.
Gary, first of all, you keep forgetting to pack your lunches, and I know damn well that's my banana you're talking about. 2, we don't shove bananas down patients' throats, let alone mine.
What in the name of Jesus of Nazareth do you mean the patient nearly choked to death on a banana?
Dr. Hawks, what do you think the correct diagnosis is then?
Yeah, we needed to know so we can save the patient.
Please tell us what we should have done differently.
We're here to learn from our mistakes, Dr. Hawks.
You think I'm here to hold your hands and spoon? Feed you the answers? You're a disgrace to the medical profession. The real diagnosis is hypokalemic paralysis. Get your act together or get out of my hospital.
Well, we were hoping you'd use the jaws of life like I did, since information is so hard to get through the thick skulls of most of your department.
Are you starting to regret taking me and Frank out of there yet?
I'm starting to regret letting anyone but myself in the recovery room, Leslie.
To be fair, I had nothing to do with the banana throating incident. Gary did that when I walked out of the room.
There's nothing fair about that. We're a team, and here you are pointing fingers.
That's pretty disgusting, both of you. Hawks obviously doesn't like that.
Thanks, kiss ass. I have it from here. I'm out. I'm getting lunch, and don't anyone dare bring up bananas for the rest of the day. Johnson, I can never, ever look at a banana the same way again without thinking of what a couple of my idiots did earlier today.
What did they do?
I'm not sure if I can discuss it openly with anyone. It's pretty embarrassing.
You're the one who brought it up. You even bought one from the vending machine.
I was planning to throw it at Gary's head later, but realized I was hungry. Anyway, how are things going for you?
Actually, things have been quite challenging. Some of my patients are responding well to treatment, but others are not showing the progress we hoped for.
That must be tough. I've been dealing with this one patient who has been presenting with a myriad of symptoms that just don't seem to fit any known disease profile.
Sounds frustrating. Have you been able to make any progress in diagnosing the patient?
I think I may have just had a breakthrough while we were talking. It all makes sense now. I need to go check on something. Excuse me, Johnson.
Wait, you're leaving. What about lunch?
I'll make it up to you later. This can't wait. Thanks for the chat, Johnson. I'll catch up with you soon. Excuse me, coming through.
Hawks, what are you doing storming in here without protective gear? You could contaminate the whole room.
Seriously, have some respect for the operating room protocols, Hawks.
This is highly inappropriate, Hawks. You need to leave immediately and come back when you're properly suited up.
I don't have time for that. Hyperkalemic periodic paralysis was a misdiagnosis. It's progressive symmetric erythrokeratodermia.
Progressive symmetric erythrokeratodermia. What's the prognosis for that?
The prognosis is not great. It's a rare genetic disorder with no cure. The symptoms can be managed, but it's a lifelong condition.
How did you come to this conclusion, Hawks?
I had a hunch and discussed it with Dr. Johnson over lunch. He agreed and we investigated further. It all fits perfectly.
Like a banana?
Don't finish that thought, Gary. You're a disgrace to humanity.
I can't believe I got the diagnosis wrong, Tracy. It was progressive symmetric erythrokeratodermia, not hyperkalemic periodic paralysis.
Congratulations on finally finding the right diagnosis, Hawks.
If only I had competent doctors working with me, this wouldn't have happened.
What do you mean by that, Hawks? You were the one who declared the wrong diagnosis.
Well, my team's performance could have been better. I should have caught my mistake.
You can't just shift the blame onto your team, Hawks. You made the call.
Scoffs, I need some fresh air. I'll see you later.
What is this banana doing on my desk?
It's an inside joke.